Hi, thank you for watching this presentation. I'd like to take this time to explore the uses of lavender essential oil and how we can use it to enhance our practice as healthcare and wellness professionals. Essential oils can be used in traditional clinical settings like hospitals and medical offices, as well as in the alternative and integrative health settings of wellness centers, massage, and physiotherapy. There are over 150 essential oils in common use, but we're going to focus on lavender. It is the most well-known and accepted essential oil with numerous benefits on both mind and body. Lavender oil can be used for its antiseptic and pain-relieving properties, but clinically it is most often used for its effect on stress, anxiety, and insomnia. Aromatherapy can be defined as the art and science of utilizing naturally extracted aromatic essences from plants to balance, harmonize, and promote the health of body, mind, and spirit. It seeks to unify physiological, psychological, and spiritual processes to enhance an individual's innate healing process. As a holistic practice, aromatherapy is both a preventative approach as well as an active method to employ during acute and chronic stages of illness or dis-ease. The use of essential oils as aromatherapy is a natural, non-invasive modality designed to affect the whole person, not just symptoms or disease, and to assist the body's natural ability to balance, regulate, heal, and maintain itself. At the end of this presentation, I will ask you to complete a brief questionnaire that will help me measure the effectiveness of my educational attempt. I would appreciate it if you'd take the time to answer the questions and also briefly let me know if you can use this information in your practice or your own self-care routine. The information that I would like to impart during this presentation includes the definition of essential oils, identification of lavender essential oil, understanding the effects of the chemical constituents of essential oils on the brain, as well as the nervous system structures that are involved. I also hope that you come away with an understanding of the current scientific research regarding lavender essential oil, anxiety and insomnia, as well as its accepted uses in the clinical setting. According to the National Association for Holistic Aromatherapy, essential oil therapy, aromatherapy, is the art and science of utilizing naturally extracted aromatic essences from plants to balance, harmonize, and promote the health of body and mind. Essential oils are aromatic compounds found in plants. They're volatile and contain hundreds of chemical components that interact on the cellular level. Recent research, often nurse-driven, supports the clinically significant effects of essential oils on both physical and emotional symptoms. There are numerous uses for essential oils, from scent, beauty products, and disinfection cleaning products, to nervous system catalyst and physiological modifier. Recently, essential oils have found their way back into healthcare with the growing popularity of integrative nursing. The human use of essential oils can be traced back through millennia based on evidence of plant distillation in the Middle East and in Egypt. Today, essential oils have found their way back into healthcare with the growing popularity of integrative nursing. Extracted by steam or hydrodistillation from the leaves, stalks, barks, roots, flowers, skins, or seeds of aromatic plants, essential oils contain volatile, complex chemical compounds, terpenes, which are antiviral, antiseptic, anti-inflammatory, esters, which are fungicidal and sedative, aldehydes, which are sedative and antiseptic, alcohols, which are antiseptic and antiviral, ketones, which can ease congestion, and phenols and oxides, which can be used as expectorants. Lavender is one of the most frequently used and well-studied essential oils. It is often a gateway essential oil, as it is easily obtained, relatively inexpensive, and has a clean, pleasant aroma. Traditionally, the uses of lavender range from use as a perfume and culinary herb to an antimicrobial agent. Historically, it has been known to have sedative properties, and modern research has shown that lavender oil is effective for anxiety and insomnia. Historically, the use of essential oils has been significant. Scholars have found evidence that the ancient Egyptians extensively used aromatics in their daily lives, extracting plant essences and incorporating them into the daily cleanliness and beauty routines. Oils were used for embalming and mummification, as well as medicinal and spiritual uses. In the 1500s in France, there was a deadly cholera outbreak. Glove makers at that time who used lavender essential oil to perfume their products were found to escape the cholera epidemic. In 1597, a German physician, Hieronymus Braunschweig, wrote several books on essential oil distillation. At that time, he referenced 25 essential oils, including rosemary, lavender, cloves, cinnamon, myrrh, and nutmeg. In the 17th century, in London during the Great Plague, essential oils played a role in protection from infection, and lavender oil was used as a remedy at that time. Essential oils play a role in nursing history as well. Florence Nightingale was known to put lavender on the foreheads of soldiers in her care during the Crimean War, and there's also documentation of her ordering a large quantity of tincture of myrrh at that time, which was used as a carminative. There are a few names that are synonymous with aromatherapy for health and wellness. René Maurice Gattefoy, a chemist, Jean Valdet, a physician, and Madame Marguerite Maury, a nurse who was credited with classifying essential oils and creating the first aromatherapy clinics in Europe. René Gattefoy is credited with having coined the term aromatherapy. After an explosion in his chemical lab, he discovered the analgesic and antiseptic effects of topical lavender oil. The process of creating lavender oil begins with harvesting the flowers, usually in the morning when their scent is at its peak, allowing it to dry for several hours, and then loading it into the vessel that will be used for distillation. Steam from boiling water passes through the plant matter, and both the volatile and the non-volatile matter rise with the steam. The steam is then cooled through a condenser and returns to a water state. This water goes into a separator in which the volatile components, which are the essential oils, rise to the top and are extracted. The water component that is left are called hydrosols and are used in the beauty industry. Mediterranean countries have the longest history of lavender cultivation and distillation. Currently, however, Bulgaria has surpassed France as the leading producer, and lavender is cultivated all over the world. In the United States, lavender plants are usually harvested in September when the plant is in full bloom and has begun to wither. International organizations such as the World Health Organization, the European Scientific Cooperative on Phytotherapy, and the European Medicines Agency approve lavender for the treatment of stress, restlessness, and anxiety as a way to treat those conditions without the risks associated with pharmacological interventions. Aromatherapy is part of the French medical school curriculum. It's prescribed by European physicians and covered by European insurance. Japanese businesses also use aromatherapy to boost productivity and to help prevent the spread of airborne infections in the workplace. Many people are seeking increased health and wellness. Tools that can be used to counteract some of the stressors and health disruptors are becoming increasingly accepted and sought after. Meditation, yoga, and other exercise, herbal and Chinese medicine, and aromatherapy are some of the tools that can be used to promote wellness. Aromatherapy produces changes in the central nervous system by direct interaction with the limbic system. When scent enters the nasal cavity, the olfactory bulb detects the aroma. The olfactory bulb is connected directly to the limbic system, which contains the amygdala, thalamus, hypothalamus, and the hippocampus. These structures are responsible for memory, for emotion, and for hormonal homeostasis. Not associated with conscious thought, these are subconscious, instinctive, and automatic. The amygdala controls the nervous system responses associated with fear and arousal. It has been linked to emotional disorders like anxiety disorder and social phobias. Scents cause immediate physiological changes in blood pressure, muscle tension, pupil size, blinking, skin temperature, and heart rate. The limbic system also controls the autonomic nervous system, regulating those things, the pulse, blood pressure, and breathing. And aromatherapy and essential oils have a direct influence on that system. Essential oils are inhaled, put on the skin, and ingested internally. Internal ingestion is controversial, and we're not going to be addressing that in this presentation. Inhalation can be done via diffuser, which disperses the molecules over a larger area, or inhaled directly from a bottle. Topical use can be neat, in which the oils are applied directly to the skin, or they can be diluted in a carrier oil before being applied. A patented oral preparation of lavender called Selexon is being produced and sold in Europe, but it's not available in the United States. So what is anxiety? Anxiety is an emotional response to perceived danger. It's a normal emotion experienced by almost everyone fairly regularly. When it becomes chronic or interferes with daily function and quality of life, it's classified as a disorder. The experience of anxiety includes feelings of nervousness, panic, and fear. These feelings can lead to social isolation, avoidance, and distress. Pharmacological approaches to anxiety include drugs classified as benzodiazepines. These medications are quite effective for the acute management of anxiety, but they have substantial side effects that carry risks, as well as the potential for abuse and dependency. Antidepressants, especially serotonergic medications, have been shown to reduce anxiety in many individuals. These medications, however, are also known to potentially have unpleasant side effects. Linalool and linaloyl acetate are the major chemical constituents in lavender oil, and they've been shown to have anxiolytic and antidepressant properties. These chemicals have been shown to modulate the NMDA receptors, which has nerve calming and anti-agitation properties. These chemical compounds also bind to serotonin transporter SERT receptors, much in the way that serotonin antidepressants do. Lavender oil exerts a similar response as these drugs do without the side effects or risk of dependency. Finding non-pharmaceutical approaches for the treatment of anxiety is important both as complementary medicine, which is using modalities that support traditional allopathic approaches, and as alternative medicine, which are approaches that can be used effectively instead of the traditional medical and pharmaceutical tools. Lavender essential oil has been shown to decrease pain score reports and to have a measurable effect on vital signs. This approach has been implemented and studied in cancer patients and heart surgery patients. Both of these populations undergo a significant amount of stress that their clinicians are often unprepared to address. Treating the whole person, including their emotional responses to their physical illnesses, results in better outcomes. Insomnia is another very common disorder, and about 10% of the population experiences chronic insomnia. Insomnia is defined as difficulty initiating or maintaining sleep or experiencing non-restorative sleep. Sleep, along with good nutrition and exercise, is one of 3 pillars of health. The importance of restorative sleep cannot be overestimated and overemphasized. Over-the-counter treatments are popular for insomnia, usually antihistamines like diphenhydramine. These medications can cause morning grogginess, as well as having unpleasant anticholinergic effects like dry mouth and throat, increased heart rate, pupil dilation, urinary retention, constipation, and at high doses, hallucinations or delirium. Prescription sleeping medications such as benzodiazepines, Ambien, and Lunesta are frequently prescribed. These often cause confusion and hallucinations, as well as causing some people to cook, eat, walk, and drive while sleeping. Some of the effects of poor, limited, or ineffective sleep are so common that many of us do not even realize that they are effects. Experiences like irritability, cognitive impairment, and poor short-term memory are unfortunately part of our daily lives. Inability to concentrate and decreased reaction time accompany sleep deprivation. The toll it takes on us physically is significant, contributing to cardiac arrhythmias and increasing the risks of heart disease, obesity, and diabetes. Aromatherapy is gaining acceptance in traditional healthcare settings. Hospitals, clinics, and long-term care facilities that utilize aromatherapy for symptom reduction have policies and procedures detailing accepted uses and required documentation. In one of the local hospital systems, approved single oils include lavender, peppermint, rosemary, and lemongrass. Approved blends are orange ginger for nausea, lavender peppermint for headache, and lavender peppermint frankincense blend for grief. An antimicrobial spray can be used in staff areas to reduce airborne infection, but is not approved for patient use in this hospital system. In summary, aromatherapy and the use of essential oils is a safe and increasingly accepted therapy for stress, sleep, and emotional distress. Essential oils have been used for thousands of years for therapeutic, cosmetic, and nutritional purposes. Reaching the brain through the olfactory system, the chemical constituents of essential oils affect physiological systems. These effects are measurable and perceptive. The active chemicals in lavender oil, which are linalool and linaloyl acetate, can be detected in the bloodstream up to 30 minutes after massaging with a diluted oil. I encourage you to learn more about the therapeutic uses of plants and how we can use plants and their essential oils to promote health in ourselves and in our communities. Thank you for watching this presentation, and please follow the link in the first comment to complete a short quiz. If you would also leave a comment saying that you have watched the presentation and what your professional or personal interest is, leave me a comment so that I know what sorts of people are watching this presentation and possibly using this information. I really appreciate your time, and thank you for watching my presentation on the clinical uses of lavender essential oil.